Hello and welcome to today's 5 on 5. We're joined today by President of Regence Blue Cross Blue Shield of Oregon, Angela Dowling. Angela, thank you so much for joining us today.
Yes, happy to be here.
So now we're 2 years into the pandemic. What sort of long-term impacts have you seen or are you expecting to see as we start that transition back to normal?
Well, COVID for sure has changed everything. When we take a look at how people have engaged in healthcare over the last couple of years, what we're seeing is people actually have foregone some of those preventative services that they've needed to address. So colonoscopies, mammographies, and just general immunizations, for example. And so the question becomes, what does that really do to our overall healthcare system over time when there's been this delay in care? And so we're going to have to watch those trends for the future. Also, there's been an adoption of telehealth. So telehealth has gone from very minimal adoption to a significant adoption. We saw a 500% increase over the 2-year period with COVID. And that allows people to have access to healthcare, access to providers, access to primary care, as well as behavioral health services. So it was pretty impactful. And then we'll see some public policy changes. I'm sure that going forward, we'll look back as a state and as a country and decide, have we addressed the needs of our communities in the way that we need to? And if this happens again, how does that change going forward? Now, I don't have a crystal ball about what that will look like, but certainly I think that we'll do a little internal review of how we can address future pandemics. Let's hope we don't have one, but if we do, how do we address those concerns?
Now, you mentioned telehealth. Telehealth options have improved people's access to healthcare, as you said. What are some of the other ways that Regence and other companies are working to improve access to healthcare?
So improving on access means getting people in to see a physician or some form of a provider. And so telehealth creates the opportunity for people to have access, whether you're in rural county or a rural location, or whether you're in an urban setting. And so telehealth allows people to have that access. Now, that's whether it's behavioral health, as I said, or any other form of access. But access can, especially for behavioral health, be critically important because we have a shortage of behavioral health providers. And what we're doing is we're improving the number or types of people who can be seen in behavioral health, such as social workers, counselors, as well as psychologists and psychiatrists. So broadening sort of the definition of a provider so that there is more access and people can get more care in various different settings. It's important that we be able to do that.
Absolutely. All right, we'll have more after this break. Hello and welcome back to our 5 on 5, where we're joined by President of Regence Blue Cross Blue Shield of Oregon, Angela Dowling. Now, Angela, Regence has had a long-standing presence in Southern Oregon, but recently you're taking on a more community-based approach. Can you elaborate on that?
Absolutely. We have had a long-standing relationship with Southern Oregon. We have a service center there with several hundred employees, as many of your viewers well know, but we're also focusing on social determinants of health. And so we're investing in the community. An example of that is with La Clinica and helping La Clinica have outreach programs and reaching out to those individuals who need it the most so that we make sure that the entire community has access to healthcare and nobody is slipping through the cracks. And so we're making that investment so that we can outreach to more individuals in the community to provide those service and access. As we talked about earlier, it's just so critical that people have access to healthcare.
Absolutely. Now, we're currently wrapping up February as Heart Health Month, and you were this year's Oregon's chair for the campaign. What are some things people can do to live a heart-healthy life?
That's a great question, and I'm honored to be the chair of Go Red for Women in Heart Health. What many people don't realize is heart health claims more lives than all forms of cancer combined. And so with that, it's very important that people understand heart health and what we can do to be heart healthy. So exercise, quit tobacco if you vape or smoke. Also, we're leading this sedentary lifestyle with COVID. We need to get back out into the community and do some exercises and just overall mental health. and take stress out of our lives. That's hard to do. It's easy to say, but it's hard to do. But think of ways to reduce the stress in your life as well.
Absolutely. Well, thank you so much for your insight, and thank you for taking time to talk with us today.
Absolutely. My pleasure. Thank you.
We'll be back after this break.